Good afternoon. I'm Mark Ramey, Chairman of the Marion County Board of Supervisors. I'm here with Kim Dorn, Director of Marion County Public Health. We're here to give you an update on COVID-19 and things that we're doing from a Marion County government perspective. So Kim, thanks for joining us this afternoon, again to give everybody an update. Let's start off just with our active case counts. Where are we at?
Okay, right now we have 101 active cases and 0 deaths.
All right, still have no reported deaths in Marion County,
Right.
101 active cases, so that's up, what, about 50 from the last time we reported last week?
It is. Last week at this time we had 54.
Okay. Still a result predominant, we had the races that came to town, so I know there's a lot of cases associated with that.
Right.
And we've also seen schools as well.
That's right.
Okay,
So.
good. We're still doing, and we're doing our contact tracing. And so you've got about, what, 40 or so
Yep.
that you're working on that aren't yet in this information?
Right. We've got about 47 that, when I looked this morning, that we're still making sure they're Marion County residents and doing some of that preliminary work before we put them in the numbers.
Okay, good, good. So let's talk a little bit about positivity rate.
Okay.
We hear that number being thrown out. The number that we use, and you and I have talked about this a lot, is we've got a certain number of active cases and we have a county of about 34,000 people.
Correct.
And we'll talk about that here in a little bit, but what is a positivity rate?
Well, the positivity rate is the, when you're talking about the 14-day rolling positivity rate that the state is talking about, it's the number of tested positive people divided by the total number of people who tested.
Okay,
So that's how they get that positivity rate.
okay,
And it is it's something that the state figures, so it's on the state website. And that number changes consistently, so it's a live number, so to speak. So yesterday it was at 16.1, this morning it was at 17.1, this afternoon it's at 17.7. So it flows with, as they input data at the state, that number just changes consistently.
so I wanted to make sure that we all understand it, because I know the press has been reporting on it, it's on the state website, we hear people talk about this. The schools have been using this number in terms of making decisions on what they do.
Right, 15% is one of their trigger points for decisions that they make at the school.
As to whether they'll meet face-to-face or go to, okay.
Right, so that is one trigger point, that 15%. The other contributing data piece is 10% absenteeism from COVID.
Okay,
So when they have those two pieces of data, then that informs them on their decision, how they're gonna move forward.
so it's a rolling number, the past 14 days, so as you
Right.
move forward, those other days drop off that math
Correct.
calculation. Testing criteria is going to have an impact on that.
Absolutely.
A little bit. So maybe describe the testing criteria that we have in public health. I know we've talked about it, but if those constraints are tighter, then you are trying to get people that you think might be positive to come in and have a test, right?
Right, so we've been pretty generous in our testing here in the last couple of weeks. And that's because we had quite a bit in the community. But we're going to narrow the scope on that a little bit and get back to being a little more strict on who may test and who we are not going to test. The state hygienic lab has some pretty specific rules about who can be tested and what criteria they need to meet. And so we're going to get realigned with that again. So we're gonna narrow that criteria, so you're gonna need to be able to tell us who is your positive contact. If, before we were saying, oh, they were at the races, they're probably,
Okay.
that kind of thing. Now we're gonna get back to business where, okay, you tell us that you've had a contact, who is that contact? So they need to be prepared to tell us, who they were around that was positive.
Right, and it's not, again, as we've done this for almost 5 months now,
Right.
since the beginning of the COVID crisis. And it's not that anybody's in trouble or anything, it's just so
No.
that you at Public Health can then take the next steps to ensure that we slow the spread of
Right.
whatever this new COVID bloom, we'll call it that. Is that correct?
That's correct, that's correct, because when we test a bunch of people that don't really need to be tested, first off, it's a drain on staff time. And we really need to be concentrating on those people who are positive and who are actually exposed, so that we can help them to not allow the spread.
Mhm.
So, the other thing is the number of tests and that we're able to get from the lab.
Right. So there's a resource issue both from a
Right.
staff perspective and the number of tests that we continue to get.
Right,
And at public health, we have to make sure that the folks who truly need the tests can get the tests.
right, but it's important to understand that the tighter we make that, it's going to make the percentage, that rolling percentage is going to go up.
Right.
Because we're not testing as many people who are negative, we're really focusing on making sure we get the people who are potentially positive.
Okay, very good. Well, Kim, I appreciate that. When we think about that, you know, the number that I go to, and I've asked you to calculate this number, we've got a county of almost 34,000 people.
Right,
And when you look at the total number of active cases, we're about, what, 0.3% of our population
That's
is
right.
currently in a state of an active case of COVID-19. So from an overall population perspective, I think we're still doing very well, especially when you look nationally at some of the other counties in Iowa, correct?
that's correct.
Okay, good. I mean, our population has taken the behaviors to heart, and those behaviors, again, are, as we go through these again, social distancing,
Right.
washing your hands, staying at home when you're sick. Those are the most critical, and the masks come into play when?
When you can't properly socially distance.
Right. So I think that's the thing we have to remember, remind everybody about. Masks don't protect you if you're within that 6-foot radius,
Right,
correct?
unless you're wearing an N95.
Right.
So, and most people are wearing cloth masks. So, and when we're determining who's exposed and who's not, if you're within 6 feet and you're wearing a cloth mask, you're still exposed.
Right.
And so we're still gonna ask you to quarantine, so the issue becomes that 6 feet.
Right.
That
Okay.
6 feet is one of the most critical things I can ask you to do.
Very good. All right. Well, again, Kim, thank you for the information. We appreciate what you and public health are doing. And we appreciate what you folks have done in Marion County to slow the spread. We continue to deal with COVID-19, and we hope soon for a vaccine. That's what we keep hearing from our federal leaders, and we hope that happens very soon. But again, socially distance, wash your hands, stay at home when you are sick, when you think you are sick. And as far as wearing a mask goes, if you can't socially distance, wear a mask. If you're not comfortable, wear a mask.
Right.
That's okay. Don't shame and don't bully people who do or don't.
Yeah.
Let people take responsibility for their own health. I'd rather live in freedom than fear, and I think we can do that and do that well. Thanks again for joining us. We'll be back with an update next week.